Welcome back. City of Detroit has been, unfortunately, one of the most acutely impacted areas of the country by the pandemic, and it has been especially deadly among African Americans. The city now has its convention center morphed into a hospital. Let's talk over the city situation with the Chief Operating Officer for the City of Detroit, Hakeem Barry. Hakeem, thanks very much for the time this morning. I appreciate it. I want to start with the way that, in general, you feel Detroiters have responded to what's going on. I've kind of been blown away that people have done as well as they have with being asked to stay inside, the social distancing, everything that I see in sort of an anecdotal way. But the mayor has also had to take out after groups that still don't quite get it. How would you say the overall response has been?
You know, it's been positive. People are starting to understand and really get the importance of sheltering in place. When I talk with a lot of our DDOT drivers, they understand that most of their passengers are those that have to get to those essential jobs that support the functions of the hospitals, the grocery stores, the hotels that are still open. And I mean, this is a different time where people in Detroit actually rely on public transportation. So, you know, we're really trying to support the need and help those that need to get to those essential jobs.
I think at the very outset of this, there are so many of us who've said in any crisis, it falls hardest on the people who are already living right on the edge, people who are living in poverty, and people who already have maybe health problems that aren't being addressed. And we're watching that play out in the city, aren't we?
Yes, absolutely. And, you know, everyone's really focused on the impact. You know, we talk about the economy, but you have to think about the actual worker that can't work anymore. So the importance of not spreading the disease and getting healthy and getting us back to our new normal is the focus.
As far as it hitting so hard in the African American community, Greg Bowens wrote a piece this week in Deadline Detroit that was interesting to a lot of people, I think, talking about specific ways to address it. That, you know, when churches are closed and community centers are closed, then the typical lines of communication in the African American community have broken down. And so we have to find ways to sort of build bridges across those breakdowns of communication, other things like that. Is the city thinking about those kinds of things?
Absolutely. And we've been using all of the social media outlets that we have. And, you know, we thank you for partners like you that actually allow the mayor to broadcast daily. So hopefully with people sheltering in place, they have that opportunity to be updated daily on where we at with our numbers, our programs, opportunities. We've dedicated our entire website at DetroitMI.gov to really offer all of the links of support that you need, whether it's testing, whether it's that you need a prescription, a ride to a test, many things as a source of resources there.
But it is a lot to ask of families that are living in maybe multi-generational situations, some of whom have no choice but to go out and work. And of course, every time they go out into the world and then come back into the home, they're kind of bringing in whatever contact they may have had that day. I mean, this really is a heavy lift on this part of our population, isn't it?
Yeah, it totally is. And you know, because I work here and want to make sure that we're providing the right services, myself and a handful of us out of our entire 9,000 employee population that work for the city, we have to make sure that we're being extra careful so that when we return home to our loved ones, we're not bringing anything back in. I personally go through a ritual daily to make sure that my family is protected for what I might have been exposed to in the day.
Yeah, similar for me as well right now. I talk a little bit about what's going on in the city's nursing homes. That's where we're really trying to get a lot of testing happening on a daily basis.
Yeah, we started to see the uptick there and the concerns in the nursing homes that may have affected patients and their staffs. And we were very fortunate to be one of the first cities to purchase the Abbott rapid test machines. And as we were first initially trying to go and test our public safety personnel, the police and fire department, we extended that over to 26 nursing homes. And so now we have a team of medical professionals going there nightly to test those. So we think in about a week, we'll be at about 1,000 of personnel within those nursing homes that will be tested, and they will actually know if they're positive or negative. And knowing is the battle there. If you know that you're positive, you know how to quarantine and then care for yourself.
I think that there's a lot of people who are very worried about two big other pieces for the city of Detroit, and that's people who are homeless and just the fact that we all talk about the food deserts that have existed over the years in the city of Detroit. People getting fed and people who actually need both food and shelter. Talk about those two efforts right now.
Well, one thing I'll say, I was amazed by the group at the city with Arthur Jemison and Donald Rensher that really jumped on to support the many homeless shelters. When the cases start hitting and affecting us here in Detroit, that was one thing that they never let die down at all. And we jumped on that to help stand up and move and test, developing quarantine sites for them as well. And on that same line, food and the outpouring support of the community to provide food. And we opened up a couple rec centers to be that conduit to getting food to those that need it.
Lastly, Hakeem, it's been interesting. The mayor has really taken issue with when he's questioned about why Detroit has been a hot spot. And I guess at one level I can understand why the question bothers him, but I also think it's very natural for us to try to figure out what it was that kind of created the problem that we've had, especially when we start thinking about the future and other pandemics that could come down the road. In fact, the return of coronavirus. Don't we need to drill down and figure out exactly why we became one of the epicenters for this virus?
I think that's important, but I wouldn't lose sight that the way we jumped on it. So after there was just 2 cases, when we began to shut down and put the shelter in place, I think we are ahead of the curve, unlike some of our other states, and they had higher cases if we look at the timeline. And I think we've done a great job of jumping on that. We've provided the mass testing site where we tested about 6,000 people in the Tri-County area here. And most of those are Detroiters, but we tested over 6,000 people in about 2 weeks. And we're trying to get up to with a goal of maybe possibly 2,000 tests a day. And we're looking to keep that going, the Abbott test machines. And we're also going into looking at how to provide surgical masks or PPE just for the general public. So earlier this week, we began to put those on our buses. And, we've cut back on our bus deployment. We sending out about 155 buses a day versus what our normal pullout would be. But we put boxes of masks on those, and we've asked the riders to wear a mask. We've began to put social distancing on the bus.
Hakeem, I get the why and the responsiveness. I mean the what, but don't we need to be worried about the why?
I think, I think that is a concern to look at, to see what happened, what are causing some of the deaths. Even if it's less than other states. We do believe that our community might have been affected. I've seen people with symptoms of no symptoms to those that are on death's door. And what's alarming to me is that the amount of people that have little to no symptoms that are actually positive. And I think that's a major point in looking at the cause of the spread. Even myself, I have a cough every morning, but I have bad allergies. So I started to question myself.
Yes, absolutely.
Am I affected? And I, was one of the first people that was tested on the rapid test machine, and I was negative. So I says, okay, well, calm down. That's my normal allergies. But for the average person, you may not think that, and you may think that cough is just your normal cough, and you could be actually infected. So that's the promotion for the test. And I'm sure that as we get to the end of this, we will be able to look back at that data and really dissect the causes.
Well, we sure hope so. And I'm glad you're healthy and safe. Hakeem, we really appreciate the time this morning. Happy Easter.
Same to you. Thank you.
You bet. When we come back, we'll dip our toe into some politics. This is Flashpoint on Local 4.